Hello everyone. Now that we have finished learning the atlas or the first cervical vertebra, let's learn today about the axis or the second cervical vertebra. The second cervical vertebra, also called as the axis, is one among the atypical cervical vertebrae. The C1 or the atlas vertebra is going to sit directly on top of the axis vertebra. So here is the C1 or the atlas vertebra, and this C1 vertebra is going to sit directly on top of the axis vertebra this way, forming the atlanto-axial joint. Now let's see the main parts of axis vertebra. The most important distinguishing feature of axis vertebra is the presence of this process called as Odentoid process or dens, which is present on the body of the vertebra. Now the main parts of axis vertebra are body, laminae, spinous process and transverse process. So first of all, the body of axis vertebra. Here comes the body of axis vertebra. This bony mass is the body of axis vertebra, and body consists of this process called as Odentoid process, which projects upwards from the superior surface of the body. Then comes the laminae. Laminae are these broad plates of bone present posterior to the vertebral foramen. So here is one laminae and here is the other laminae, and as you know, the laminae fuse together in the midline to form the spinous process. So here is the two laminae and they fuse in the midline to form the spinous process. So that is the spinous process. Then comes the transverse process. Here are the two transverse processes on either sides, and you can see the foramen transverse area found piercing the transverse process. So these are the main parts of axis vertebra. Now let's see the anatomical position of axis vertebra. So the most important distinguishing point of axis vertebra is the presence of Odentoid process or the dens, which projects upwards from the superior surface of the body. Now in normal anatomical position, this Odentoid process, it projects upwards from the superior surface of the body of axis vertebra. So as I told, here is the body of axis vertebra, and here comes the superior surface of the body of axis vertebra, and from the superior surface projects upward this process called as Odentoid process. So Odentoid process projects upwards from the superior surface of the body. So this is the superior aspect of the bone and this is the inferior aspect of the bone. Now the body with the Odentoid process, it is located anteriorly, while the spinous process, which is formed by the fusion of the two laminae in the midline, and this spinous process, it projects posteriorly. So once again, the body with the Odentoid process is located anteriorly, while the spinous process, it projects posteriorly. Now let's see each of these main parts in detail. First of all, about the body. So here is the body. This bony mass is the body of axis vertebra, and body consists of a superior surface, and the Odentoid process arises from the superior surface of the body. Now this Odentoid process, it is also called as dens. It is one very important bony feature. Now let's see in detail about the Odentoid process. The Odentoid process is a strong tooth-like process attached by its base to the superior surface of the body. So here is the superior surface of the body, and the Odentoid process, the base of the Odentoid process is attached onto the superior surface of the body, and its apex projects upwards and is pointed. So the Odentoid process consists of a base and a pointed apex, and the base of the Odentoid process is attached to the superior surface of the body, while the apex, which is pointed, it projects upwards. Now the Odentoid process is half an inch long. So the length is half an inch, and the Odentoid process represents the body of atlas vertebra. Atlas vertebra, as you know, it is the first cervical vertebra, the C1 vertebra. So here is the atlas vertebra, and this is how the atlanto-axial joint is formed, that is the odentoid process, the anterior surface of the odentoid process comes in relation to the posterior surface of the anterior arch of atlas, and this is how the atlanto-axial joint is formed. Okay, so when this joint is formed, the odentoid process, it represents the body of atlas vertebra. As you know, atlas vertebra consists of no body. So for atlas vertebra there is no body. Instead, it is this odentoid process that represents the body of atlas vertebra, or in other words, the odentoid process, it actually replaces the body of atlas vertebra. Now, the odentoid process acts as a pivot around which the atlas with skull rotates. Now, what is a pivot? A pivot is the central point or shaft on which a mechanism turns or oscillates. Okay. Now, here is the atlas vertebra, and this is how the atlas and axis vertebra articulates to form the atlanto-axial joint, and you can note the position of odentoid process. The anterior surface of the odentoid process comes in relation with the posterior surface of the anterior arch of atlas. Now the atlanto-axial joint, it is a pivot type of joint and it is actually a movable joint. Okay, so the odentoid process, it acts as a pivot around which the atlas with skull rotates. So the superior articular facets of the atlas vertebra articulates with the skull, that is the occipital bone of the skull, which we have seen when we studied the atlas vertebra. So this way the atlanto-occipital joint is formed. Okay, so atlanto-occipital joint and then the atlanto-axial joint. So when this joint, these three joints are formed, the atlanto-axial joint, which is a movable joint, when the skull rotates, the rotation actually happens like this. That is, when you see from here, when the skull together with the atlas rotates, it is like rotating over the axis. So the skull bone along with the atlas rotates over the axis. So in doing so, the odentoid process, it acts as a pivot or a central axis around which the atlas along with the skull rotates. So this way the odentoid process acts as a central axis or pivot around which the atlas with the skull rotates. Now the odentoid process, it has got a small oval facet on its anterior surface which articulates with the facet on the posterior surface of the anterior arch of atlas. So here this is the anterior surface of the odentoid process. So here is the anatomical position of the bone, the odentoid process, and here comes the anterior surface of the odentoid process. And when you observe the anterior surface of the odentoid process, you can see a small oval facet here, and this small oval facet, it is actually an articular facet, and this facet, it articulates with the posterior surface of the anterior arch of atlas. So when the atlanto-axial joint is formed this way, you can see that the anterior surface of the odentoid process articulates with the posterior surface of the anterior arch of atlas. Okay, so when we studied the anterior arch of atlas, we have seen a articular facet present in the posterior surface of the anterior arch of atlas. This articular facet present in the posterior surface of the anterior arch of atlas. So the odentoid process articulates with this facet. So a facet present in the anterior surface of the odentoid process articulates with the facet present on the posterior surface of the anterior arch of atlas. So this articulation, it also forms a part of the atlanto-axial joint. Now the odentoid process has got a groove on its posterior surface across which passes the transverse ligament of atlas. Okay, So here comes the base of the odentoid process, which is attached to the superior surface of the body of axis vertebra, and near to its base there is a groove, and this groove on the posterior surface of the odentoid process, and through this groove passes the transverse ligament of atlas. Okay, so when the atlas and axis articulates like this, and we have studied about the transverse ligament when we studied about the atlas vertebra. So transverse ligament is a ligament which attaches from the tubercle on the medial surface of the lateral mass. So the transverse ligament of atlas, it extends from the tubercle on the medial side of lateral mass on one side to the tubercle on the medial side of the lateral mass of the other side. So the transverse ligament of atlas, it extends between these two tubercles. So while extending between these two tubercles, the transverse ligament of atlas, it is lodged in this groove present on the posterior surface of the odentoid process. So this groove through which passes the transverse ligament of atlas. And the function of transverse ligament of atlas is to keep the odentoid process in its position. Okay, so the transverse ligament of atlas, which extends between the tubercles present on the medial side of the lateral masses, it passes through the groove present on the posterior surface of the odentoid process, and while doing so, this transverse ligament of atlas, it keeps the odentoid process in position. Okay, so the transverse ligament of atlas, it passes like this and it keeps the odentoid process in position. Now let me tell you about the attachments onto the odentoid process. Now the apex of the odentoid process gives attachment to the apical ligament of dens. So apical ligament of dens, it is a ligament which extends between the tip of odentoid process to the anterior margin of foramen magnum. Now the next attachment is that of LR ligament. LR ligament is a ligament which attaches onto the sides of the odentoid process, onto the sides below the apex. That is where the attachment of the LR ligament comes, and LR ligament is a ligament which gets attached from the sides of the odentoid process to the tubercles on the medial side of occipital condyle. Now that's all about the odentoid process and its attachment. Now let's see the rest of the features of the body. Now the superior articular facets are present on either side of the upper surface of the body. So here comes the superior articular facets. So here is the odentoid process and the body with the odentoid process, and these two facets, articular facets which you see here, these are the superior articular facets. So the superior articular facets, they are present on either side of the upper surface of the body. Now same way the inferior articular facets are present in the inferior aspect. So this is the inferior surface of the body, and here you can see two facets. These are the inferior articular facets. So inferior articular facets are present towards the inferior aspect of the bone, and here comes the superior articular facets. The superior articular facets are present on either side of the upper surface of the body. Next we are going to see about the laminae. So as you know, laminae are broad plates of bone which forms the posterior boundary of the vertebral foramen. So here is the vertebral foramen, and these two plates of bones are the laminae. Laminae are the thickest and strongest among all cervical vertebrae. So as you can see here, these laminae, the laminae of the axis vertebra, are the thickest and strongest among all cervical vertebrae. So among all cervical vertebrae, the axis vertebrae has got the thickest and strongest laminae. So these are the two laminae. Then the laminae, as you know, fuse together in the midline to form the spinous process. Okay, so next we are going to talk about the spinous process. The spinous process of axis vertebrae is large and very strong. Okay, so the laminae fuse in the midline to form the spinous process, and the spinous process is large and very strong. and it is also bifid. That is, it ends in two tubercles. So here are the two tubercles. So the spinous process is bifid, that is, it ends in two tubercles, and the spinous process is large and very strong. So the two laminae fuse in the midline to form the spinous process, and the spinous process of axis vertebrae is large and very strong, and it is bifid, that is, it ends in two tubercles. So these are the two tubercles forming the bifid spinous process, and the bifid spinous process is a characteristic feature of cervical vertebrae. Now the spinous process, it gives attachment to the ligamentum nuchae. The tip of the spinous process gives attachment to the ligamentum nuchae. Now coming to the transverse process, the transverse process of axis vertebra is very small. So here is the transverse process. This is the transverse process of this side, and this is the transverse process of other side, and the transverse process, as you can see, it is very small and it do not present anterior and posterior tubercles. Okay, the transverse process do not present anterior and posterior tubercle like that of typical cervical vertebrae, and the transverse process is very small, and you can see the presence of foramen transversarium. So here is a foramen transversarium. The foramen transversarium is there, which is the typical feature of cervical vertebrae, and foramen transversarium is found piercing the transverse process. Now that's all about the axis vertebrae today. Now let me conclude by telling you about the main parts once again. So here is the body of the axis vertebra. Here is the body along with the Odentoid process. Now the superior articular facets are present on either sides of the upper surface of the body, and here comes the inferior articular facets which are present in the inferior aspect of the vertebra, and here comes the two laminae, and the laminae fuse in the midline to form the spinous process which is bifid, and here comes the transverse process which is very small and with the foramen transversarium present in it.